లాస్ట్ క్లాసా?
ఇండియస్ అండి మేడం.
లాస్ట్ క్లాస్ అంటే మనకు ఇది ఉంది కదా,
శ్రీ విద్య
నుంచి 4:30 నుంచి 4:30
వాళ్ళే వచ్చేటోళ్ళు. రెండో నెంబర్ ఉన్నదంటే వాళ్ళే ఇక
చేసిన. ఓకే సెకండ్ అన్న లైన్ ఉంది.
ఇది స్టార్ట్ అయిందా ఇప్పుడే?
ఇది సంగీత వచ్చిరా? ఓకే, పోస్ట్ ఇచ్చేస్తా సంగీత. ఓకేనా? లైవ్ ఇచ్చేస్తా. ఓకే ఓకే.
ఇది అయిపోయిందా?
కొత్తగా
ఎవరైనా
కొత్త క్లాస్
బాట్నియా? మరి సునీల్ కుమార్ ఎట్లా
తగ్గితే ఏమని చెప్పట్లేదు. వచ్చింది ఏమని
కొత్తదా? కొత్తదా?
కొత్తది. మోహన్
లేడు కదా మోహన్.
రాసుడు ఈ కింద ఉంటాడు కావచ్చు. వాళ్ళే
చేంజ్ చేసి ఇది కూడా చేంజ్ చేయాలి.
మోహన్ మళ్ళీ మోహన్ అన్న మురళీకృష్ణ అని చెప్తారు. వాళ్ళిద్దరు లోకోళ్ళు. ఇక్కడ ఉన్నాడు ఈయన తర్వాత వస్తాడు. మురళీకృష్ణ కిందకి వస్తాడు. మోహన్ మీదకి వచ్చినప్పుడు
Yes, enzyme inhibition. So we know that the inhibition nothing but the prevent to stop. So in this particular topic with the enzyme inhibition, so with
సంగీతానా
chemical substance.
ఇప్పుడు ఆమె ఆ టైంలో ఎవరు లేరంట. ఈ టైంలో లేదు కాబట్టి చెప్పుకోలేదు. లేదు లేనంది ఫస్ట్ అనుకున్నారు కానీ తర్వాత వస్తే వస్తాడేమో మరి చెప్పలేము. కానీ ఇప్పుడైతే ఆయన లేదు. ఫీమేక్ ఇచ్చేసాను.
అంతా గోల్మ చేస్తుంటారు. నా దగ్గర అందరు వచ్చేసారబ్బా. ఈ జ్యోతి చైతన్య అంట జువాలజీ. ఇది జువాలజీ అదే
ఈ జ్యోతి ఉంది కదా
నేను చూడలేదు. ఒక చెక్ చేసి
కాదు అటెండెన్స్ వేసుకున్నా.
ఏం చేయబోతే మనం ఏం చేస్తాం.
అంత ముందు యశ్వంత్ అది మాకు యూజీ అయినా 1 అవర్ కాగానే కట్ అయిపోయింది ఆటోమేటిక్ గా. అప్పుడు అట్లా పెట్టినట్టుగా లేదు అయింది.
ఏం చేస్తాం
1 అవర్ కాగానే 0 పడుతుంది అంతే. పక్కన కట్ అయిపోయేది.
ఫస్ట్ మెసేజ్ పెడతాం చూడరు.
అందులో లీడర్ అయిపోతాం కదా. అందరూ చేయరు. ఇంకోటి ఏంటంటే ఎవరు రావట్లేరు, ఎవరైనా వస్తే ఏదైనా మెసేజ్ పెడతారేమో, క్వశ్చన్స్ అడుగుతారు.
స్టూడెంట్స్ ఉన్నారు
ఎవరు లేరు, ఇక చెప్పుడు బోడే బోడే చెవిటోని ముందర శంఖ.
అంతే.
మ్యూజిక్ లేడు, దేనికి లేదు.
చెప్పండి చెప్పండి.
కొత్తగా ట్రై చేసింది కానీ రావట్లేదు. రావడం లేట్ వచ్చింది. స్టార్ట్ అయ్యి
10 o'clock అని పెట్టుకుంటాం.
తర్వాత పెట్టింది. నిన్న 9:30 పెట్టింది. పొద్దున్న చూసుకోవాలి.
ఏం రాస్తావు ఇది?
మొత్తం ఆల్ ఓవర్.
The entire engine
అదేంటి 2 ఆగింది. తీసి అది
మీ సబ్జెక్ట్
ఆయన ఆర్గనైజర్
మరి రాలేదు. మంచిగా ఎంత హుషారు.
ఇచ్చింది కదా అందరికి. రోజంతా ఆడండి.
కొంచెం లేట్ వచ్చేసారు.
AC inhibitors. So AC angiotensin converting enzyme. So that the AC is one of the important enzyme where it is converting the angiotensin. Where the angiotensin exists in the two forms.
కాదు అది కాదు, అది నోట్ ప్యాడ్ ఓపెన్ చేసుకొని చెప్తాడు.
Exist in the two forms like angiotensin. So angiotensin 1 where it is a decapeptide, and angiotensin 2 it is octapeptide. So where the angiotensin 1, so where it is undergoes the hydrolysis and it hydrolyzes and converts into
ఫిజిక్స్
వేరే వాళ్ళు వచ్చారు. ఆమె ప్లేస్ లో ఆమె వేరే వచ్చారు.
ఫిజిక్స్ సంగీత
షెడ్యూల్ చేంజ్ అయింది.
సంగీత అని రాసుకోండి.
వేసింది మేడం, వేసింది ఇందాక వేసింది. 3:30 నుంచి 3 నుంచి 4:30 ఉంది ఆమెది.
డిప్లొమా మార్కెటింగ్ రాస్తా. డిప్లొమా మార్కెటింగ్ రాస్తా. చెప్పు పేరు. వసుదా సాగు. మీ వసుదా. హిందీ రాస్తా. రజనీదారి హిందీ.
జువాలజీ ఆయన ఏమన్నాడు ఇందాక వెళ్ళిపోతున్నా అన్నాడు. జువాలజీ ఆయన మా దగ్గర ఫోన్ చేసేవారు ఇందాక ఫస్ట్ సెషన్ లో
పబ్లిక్
వెళ్ళిపోతుండే
పబ్లిక్ సైన్స్ లేపలేదు. జాలజీ అదే కిరణ్ స్వరూప్ ఉన్నారు కదా, లేపితే లేపలేదు ఆయన.
ఇప్పుడు ఎవరు ఉన్నారు జాయిన్ అయ్యారు కదా,
జాయిన్ అయ్యారు. జాలజీ కదా మేడం. చెప్తుంది ఈమె జ్యోతి చైతన్య మేడం చెప్తుంది.
అవునా
వచ్చేసినట్టే కదా అటెండెన్స్. ఇంకా ఇద్దరా సమయ సారథి 1 2 3
ముగ్గురు అదొకటి అదుండే వద్దు కానీ
Yes, so angiotensin 2, it is converting into angiotensin 2. And generally here it is a octapeptide, it is a decapeptide here. 10 peptide bonds are there. Here is a octapeptide, 8 peptides. And generally this is a active form here. This is inactive form. This is the active form here. So it is regulating the, right? So it regulating the blood pressure, BP. Okay.
మూతికి గుర్చుకున్నా చెట్టుకి అర్థమైతేనే ఉంది.
The angiotensin conversion is more. Okay, so when this angiotensin 1 converts into angiotensin 2, so with the more conversion takes place here, more conversion leads to increase in the blood pressure, BP. Right. So in that case, where the drugs like captopril or any other drugs are used to
ఆయన లేదండి, ఆయన క్లాసుకు పోయింది పీజీ కాలేజ్. ఎంత కూర్చుంది ముందు ఎక్కడ దేవుడు కుశంగరం కూడా పెట్టిన వెలికి పిల్లల్ని తీసుకొస్తాను ఆయన
So,
ఏమో మరి వాళ్ళు వచ్చినారు
the cap. So,
కూర్చోబెట్టి వెళ్ళిపోయారు
yes.
చేసినా కదా అయిపోయింది మళ్ళీ ఇంకో ఇమీడియట్ గా మళ్ళా 1:30
ఉన్నాయి మరి
హాఫ్ అన్ అవర్ గ్యాప్ ఉంటుంది
లంచ్ టైం లేదు మీకు లంచ్ టైం లేదు అసలు సాయంత్రం వెళ్ళిపోయాను
ఇప్పుడే
దిగు వెళ్తున్నా మళ్ళీ నేను
H plus K plus ATP in the main because generally we call it is a proton pump. And it is secretion. So in gastric acid secretion, stomach, it is a defective mechanism, defective process. The bacterial also bacterial population. And just and so here the excess acid secretion, gastric disorder, peptic acid secretion, acid, we have the roots here. So here is neutralizing the acid, which is excess released acid here. So you can utilize that excess by using the acids and by blocking the H2 receptor by drug or radial here, and by inhibiting the that is a proton by H plus K plus enzyme with the proper drugs that is omeprazole. So here we are using the omeprazole to inhibit the particular enzyme activity here. So omeprazole is acting as the inhibitor for this H plus K plus ATPase enzyme. And if you see the synthesis of this ozone, so very simple synthesis. It is a this particular acetylation reaction. So where this acetylation, any acetylation, okay, together, any acetylation is taking place when it's pure. And this is further undergoing the nitration. So for nitration, with uh, meta nitration is taking place with respect of this ethoxy group. With the meta nitration is taking place here. Then upon hydrolysis, where this amide bond is going to cleave. Amide bond is going to cleave, and we are getting means the back to amine group here. And further, it is undergoing and upon reduction, where this nitro group is converting into NH2 here. So, and this further, this we are treating with urea. There is a urea here. So, we are treating with urea, where the urea moiety is going to couple with this particular two amino group. Right? So, where the urea is coupling to this particular two urea amino moieties on this particular methoxy benzene. Then by treating with the phosphorus chloride, with the phosphate chloride, so with is going to chlorination is taking place. And then attached to compound, by doing the oxidation with hydrogen peroxide, that it will be omega again.
అట్లా
This is
చేస్తారు కదా. పోనీ మిగతా సబ్జెక్టులు అంటే ఓకే, మ్యాథ్స్ కూడా అట్లనే చేస్తున్నాడు. బుక్ పెట్టుకొని చదువుతుంటే ఏమర్థమవుతుంది మరి?
ఈ సార్ వరకు పోయిందనుకో మొత్తం దీని మీద మొత్తం తీసి పడేస్తాడు. అది పోలేనట్టుంది ఆయనకి ఇంకా ఇన్ఫర్మేషన్.
చక్రపాణి సార్ ఏపీలో కంట, ఏపీ స్టూడెంట్స్ కంట ఓన్లీ ఏపీ. నేను ఇందాక అందుకనే మా పిల్లల్ని జాయిన్ చేయమని చెప్తే మనకు కాదు అని చెప్తుంది.
అట్లా కూడా ఉందా?
మన వాళ్ళకైతే కష్టం అవుతుంది మళ్ళీ. ఆడ ఆఫ్లైన్ క్లాసులు అవుతున్నాయి మా దగ్గర.
మన వాళ్ళు కూడా ఇట్లనే చెప్తారు
ఇట్లనే, కానీ వాళ్ళకి ఎత్తి పడేసినాం కదా అందుకని. లేదు ఆన్లైన్
స్లైడ్ చేసి చెప్తున్నట్టు కొంచెం
ఇలా ఎంతమంది వచ్చారు? మీతో అంతా సున్నానా?
అట్లా కాలేదు ఇక గోవా స్టోర్ కానీ 2 రోజులు వచ్చిందంటే అలాగే ఇట్లా అయిపోయింది. నడుతుంది.
Communicate hydrates, communicators,
Not hearing anything. Turn up volume. Not hearing anything అంటే ఎవరు జాయిన్ అయ్యండి?
we have carbon dioxide water metabolized carbonic acid is to so this carbonic acid is means it is undergoing ionized as a H plus and HCO3. Okay, and this HCO3 is taken to here the sodium is it is combined with this bicarbonate, and it is bicarbonate ion here, and it is it's stated as a sodium bicarbonate to the urine. So it's change in the glomerular filtration rate of defect in the tubular. So the reabsorption of kidney function, it is resulting in the abnormal increase in the volume of that urine here, and it is generally it is causing for the edema, right? So accumulation of edema, nothing but with the edema, nothing but the accumulation of water here, accumulation of water H2O. Okay. So within in that case, so with this the H plus ions, the tubular fluids, it is combined with the bicarbonate and and it is metabolized to CO3 and H2O here. So here the inhibition of this carbonic anhydride it reduces the supply of these ions so that the sodium and bicarbonate remains in the tubular bed and excreted in the urine. So this is a mechanism established in this particular um, carbonic anhydrase enzyme inhibition here. So this result in the basic alkaline urine with a high sodium bicarbonate content here. And the, the diuretic, we have some examples under this diuretic, where the nephrotic syndrome means where it is causing some diseases like edema of pregnancy and diabetes and nephrotic syndrome. So all these are the abnormalities due to that the accumulation of water in the body tissues here. So here that acetazolamide drug, which is acting against your carbonic anhydrase enzyme, and it is stopping the activity of the carbonic anhydrase enzyme. So in such a way where we can decrease the we can decrease the reabsorption, sodium reabsorption from the body tissues here. The acetazolamide, this is acting against carbonic anhydrase enzyme. So we have the synthesis of this acetazolamide, and synthesis is very simple. This particular thiazide. So this and installation for then it is speaking with the thionyl fluoride. Is going to access, and we are SO2Cl here, and further by with the ammonium hydroxide, the chlorine is substituted with the ammonia, and we got this sulfonamide, and finally getting the acetazolamide. Next, glucosidates inhibitors. The example under this is the xanthine. The xanthine is a glycosidase inhibitor, which is usually referred to as the cancer drug. So the cyclization takes this, and finally by doing treating with the hydrolysis engine, and we are getting this value. Here the mode of action. If you see the like, monosaccharide, disaccharide, polysaccharides anything here. So where these like starch and glycogen, etc. So these are converts into the simple monosaccharides like glucose, fructose. Okay. But in case of cancer infections, where the glucose and fructose molecules are rapidly used for this growing for the carcinogenic cells here. So instead of releasing the energy, instead of consuming by the humans, instead of utilizing for this metabolic process, so it is used for the cancer cell growth here. So hence, to stop this growth of cancer cells, right? So to stop this growth of the cancer cells, that glucose is in the inhibitor, that is a svansonine, it is administered, and it is preventing the glycolysis process here. The next active one immune system. So the immune system, generally immune system it is a defense system. Immune system is defense from the body, and it have and self-controlled body. So it from substances. So and antibodies. So generally, gems and antibodies. And the process of the antibody, we have the RNAs here, epitope, size, solubility, complexity. So the biomolecule to act as antigen, it should be a foreign body, and it should be from a different organism or plant or animal. Yeah, the antibodies, generally the antibodies, these are preventing from the attack of the antigens like pathogens or the microorganisms. And we have some different types of antigens, antibodies here, like immunoglobulin. We have the IgG. This form major part of like 99% of these IgG is accumulated in the body. Then IgA. So this is more infectious of saliva, nasal, urine, intestinal infections here. So it's a general found in the dimer form. And IgM, this is largest immunoglobulin among all the immunoglobulins. IgD is produced in the allergic conditions. So when we feel allergic conditions, so we can then the IgD is produced. And IgE, this is this is also produced in the allergic conditions. So all immunoglobulins have the general structure of the two heavy chains and two light chains, yeah, where they are connected with this disulfide linkage. The ends which carry suppression of the immune system is called immunosuppressor. The immune system needs to be suppressed through like when the organ transplantation takes place, the autoimmune diseases, in case of the autoimmune diseases. In the autoimmune diseases, autoimmune diseases, we have the rheumatoid arthritis in adults and juvenile diabetes in children. And if you see the structural features of the cyclosporine, the cyclosporine is a immunosuppressing agent and it is produced by the fungus Tolipoclodin infectum. Tolipoclodin infectum. And generally here the immune system, when they are responding by producing antibodies against the transplanted organism, assuming that they are the foreign bodies here. So in order to suppress immune system during that period of that transplantation, so drugs like cyclosporin, they are given and these types of drugs are called immunosuppression. So in complex, generally it is a polypeptide complex. However, cyclic peptide comprised of double amino acids, residues, and 9 carbonyl gene. So we have this the residues here, L amino acid and L alpha amino acid. So L this was 9 L value 5 and 11 position. And 7 position was okay. So we have this amino acids. And in the second position, okay. Here in the second position, we have this then in the third position we have the carboxyl N-methyl glycine. So here the third position, here is the third position. We have the sarcosine and 4, 6, 9. Yeah, the 4, then 6 and yeah, the 9 and 10 also. Right? So 4 here, 6 here, okay, 4, 6, 9 and 10. Okay. 4, 6, 9, 10. We have the M lights. And at 5 and 11 positions, we have the L value. Here is 5. Okay, this is 5 here. And 11. 11. Okay, we have L division. Sorry, L value. And at the 8th position, 7th position, we have the alanine here. they will have that, analysis. Immunoenhancers, generally these are the vaccines here. Yeah, the vaccines, they play an important role in the immune enhancer, and they are active in the immune system of an individual. Before this is the attacks of the individual. Yeah, the immunity to infectious disease it is caused by microorganisms and can be achieved by active or the passive immunization. The passive immunization generally it is achieved by vaccinating an individual with the antibodies from humans or the animals here, like diphtheria, rabies, okay, rabies and measles and hepatitis A, B, tetanus. So all these are the diseases. Okay, all these diseases are prevented by doing that passive immunization. And active immunity is it is achieved by inoculation of the microbes, pathogens that induce the immunity, but do not harm or cause the disease with antigenic compound from that pathogen. There is a hepatitis B vaccine, diphtheria, tetanus, prevalent measles, rubella, pneumonia vaccine. So these are examples under this particular active immunization and passive immunization. And here the active immunizations, further it is two types, like live attenuated and killed absence here. So here the inactivated exotoxins, then these are used as the vaccines for the diseases here. And the drug compound which are used as a immunoenhancer is a levomethol. Levomethol is only the drug potent anti-helmintic gas having the stimulates both experimental animals and the man. That's the drugs affecting cholinergic nervous system. Cholinergic, the effects stimulus the cholinergic, like the parasympathetic nervous system by external divided into two types of visual axes, like muscarine and nicotinic accents here. And they input that particular peristaltic motions in gastric, intestine, and urinary tract infections, like increased flow of secretory glands and pituitary constrict. constituents. So all these are the things. Here is a muscarine structure. You can see where it is having the quaternary nitrogen and the nicotine. So the nicotine and muscarine, these are the cholinergic receptors. Cholinergic receptor agonist. So you know that agonist and antagonist. Okay, so agonist. What is agonist and antagonist here? So agonist uh, is low. Okay, so when the production is low, by using the agonist here, and when the production is high, so you can decrease by using the antagonist. The two terminology used in the medicinal chemistry. The acetylcholine. Acetylcholine is it is a neurotransmitter. It is from that particular presynaptic nerve ending into the synapse here. The physiological effects by the action of respective receptor is known as this acetylcholine receptors. And biosynthesis of this acetylcholine. So here the acetylcholine, it is synthesized by biosynthesis process here. It is like by taking this particular with the dihydroxy amine. Okay, so when it is undergoing the decarboxylation, so it is going to form the ethanol amine here, and when it is treating with this, whether it is undergoing the reaction with the choline and methyl transferase enzyme CNMT, so it is going to form as your quaternary ammonium alcohol. We call this choline, and this finally this choline is undergoing the reaction with the choline acetyl transferase enzyme, acetyl coenzyme. So in the presence of all these two enzymes, so it is going to convert as acetylcholine. The synthesized acetylcholine, it is sorted in storage vessels which on release pharmacological effects by acting on these respective receptors here. And the inactivation of this acetylcholine, choline acetyl transferase, the enzyme which catalyzes the transfer of the acetyl group from the acetyl coenzyme A to choline, is inhibited by that trans N-methyl for vinyl pyrimidine iodide here. Okay. And choline agonists are of two types. We have the muscarine agonist and nicotinic agonist here. Muscarine agonist, the clinical use for this muscarine agonist are it is switching of the gastrointestinal tract and urinary tract surgery, and treatment of certain heart defects by decreasing the heart muscle activity and heart rate here. Here is some example under this particular muscarine agonist. Next, nicotinic agonist. General these drugs used in the treatment of the myasthenia gravis. Yeah. Here the acetylcholine synthesis can do the acetylcholine synthesis, the chemical method by taking the tetsediamine here, NN and trimethylamine. Yeah. So it is treated with this particular chloroethyl ethanoate. So it is going to form your acetylcholine. And we have the importance and the utilize uses of this particular acetyl choline. So So the first, you can see the uses of this one. Yeah, the spontaneous release of acetylcholine at parasympathetic now ending result in the involuntary contraction of the plasma of the muscle here. It is useful for gastric secretion and it is useful for relief of post preparatory site of the gut and urinary bladder. And it increases the gastrointestinal mobility here. And the excess amount of acetylcholine can be controlled by certain anticholinergic drugs known as the acetylcholine receptor antagonist. And the synthesis of this carbachol. So we can see the carbachol with the means in the acetylcholine we have the acetyl group here, and here we have the amide group CONS2. And the synthesis is done by taking the choline chloride. When this choline chloride is treated with the carbonyl chloride here, so we are getting this carbonyl choline chloride. Then by finally treating with ammonium hydroxide, is giving the carbachol. And the uses of this carbachol, carbachol is used in the glaucoma to reduce the intramolecular pressure here. And carbachol possesses both muscarine and nicotinic actions of acetylcholine. It is employed in variability in the urinary retention. And one more example is bethanacol here. So bethanacol, carbachol and the bethanacol. Here the bethanacol chloride is prepared by the interaction of beta methyl chloride chlorine with carbonyl chloride in chloroform solution here. And finally by treating with the ammonia. So the synthesis same as your carbachol here. Only thing is the starting material is going to change here. Okay, so where the starting material is going to change. And it is used in the treatment of urinary retention. So where it is resulting from the general anesthetic or the diabetic and succinyl chloride here. Succinyl chloride also it is used in the muscle contraction here. And the synthesis by taking this dicarbonyl chloride. It is treated with right. So dimethylamine hydroxy derivative. When the 2 moles of this particular hydroxy derivative is taken, we get this dimeric structure here. Then finally, by treating with chloromethyl, 2 moles here. So we where this tertiary amine is converting into quaternary amine here. So we chloride, succinyl choline chloride. Next, anticholinergic drugs. The anticholinergic drugs of normal um, muscular activity to normal levels by preventing the acetylcholine from producing an excessive stimulatory effect. The violent contraction of this very smooth muscles like intestine, stomach, head, blood vessels, etc. Due to an excessive quantity of acetylcholine, like it is called spam. It's the reason why the anticholinergic drugs are called as the anti-spasmodic agent, which are essentially anti-epidemic action here. These drugs inhibit the interaction of the acetylcholine with the cholinergic receptors. The anticholinergic agents decreases secretions of saliva and gas use and decreasing the gastrointestinal and urinary uh, diuretic pupil. And they are used in the treatment of gastrointestinal disease such as peptic ulcers and ophthalmology and in the treatment of the Parkinson's disease also. of atropine. By taking the atropine, when it is treated with the tropinic acid, so in case of acid medium, here the tropinic acid in the brackets here. So by removal of water, is to so minus H2O. So it is going to upon dehydration, it is going to become the tropine. And tropine is a strong anti spasmodic drug. So already we told that because it is told as a spam. So why it is spam here? So generally here they are used to treat for this smooth muscles here. Okay, smooth muscles diseases. So due to these reasons, we call it as a spam here. So here the atropine is a strong anti-spasmodic drug, and it controls the spams in many ways. It is a specific antidote to prevent the muscarine effect of acetylcholine. Accumulation such as vomiting, abdomen, diarrhea, and salivation and sweating, so bronchoconstriction. So all these conditions we use this particular atropine, and some other examples also given under this particular cholinergic antagonist. Yeah, uh, here is a homotropin here. So homotropin, like this also tropin derivative only, but the difference is where is okay, the conformation changes is there. Right, so where is atropine, so it is having the okay, so it is having the tropin moiety. Okay, atropine is having tropin moiety. Here also having the tropin. Only the a small change, like in the tropin, in the atropine. So we have the right. So with this, right, the ester linkage is this ester linkage. And in the homotropin also we have the ester linkage, but only thing is here the methyl hydroxy. Okay, methyl hydroxy group is there, but here we have the hydroxy group. So only like CH2, right, is CH2 group. Difference in the CH2 group. It is homotropin. And the homotropin is synthesized by using the by taking the tropin as a starting material here, and it is treated with the mandelic acid, where the atropine is synthesized by using the propinic acid, and tropin here is synthesized by taking the tropin and mandelic acid here in the presence of HCl. So same here, here also the way the removal of water is taking place here, right? Minus H2O is taking place. Only difference is it is having the hydroxy, here is having the methyl hydroxy. That is the difference in both cases. Next, nicotinic antagonist. It's a nicotinic receptors generally they are present in the nerve synapses at the ganglia as well as in the neuromuscular synapses here. Synapses, you know that synapses is with the two nerves, okay, connecting part here. For example, here neuron, okay, and here the neuron. So this part is called the synapses. Okay. The antagonist of gangliononic nicotinic receptor sites. These are not therapeutic useful here because they cannot distinguish between the uh, ganglion of the synaptic nerve system and the ganglion of the parasympathetic nerve system. So consequently, they have many side effects. However, the antagonist of the neuromuscular is not therapeutic. Yeah. They cannot distinguish between the ganglion of the sympathetic and parasympathetic nerve system here. And generally, they have many side effects due to these reasons. So they have many side effects. Okay. However, the antagonist of the neuromuscular junction are uh, therapeutically useful and they're known as the neuromuscular blocking agent. Ganglionic antagonist. We have the tetraethyl ammonium salt. It is acting as a ganglionic antagonist here. And tuberculin. It's tuberculin. This is also one of the neuromuscular antagonist here. Next, cholinesterase enzyme inhibitors, the anticholinesterases. Yeah, the anticholinesterase are the inhibitors of acetylcholinesterase, the enzyme that hydrolyzes acetylcholine. If any acetylcholine is not destroyed, so it can return to reactive the cholinesterase receptor and increase the cholinergic effects here. So we have acetylcholinesterase inhibitor. They have same biological activity of biological effect or the activity of that particular cholinergic agonist. And this particular, right? So where we have this acetylcholine when it is treated, when it's reacted or interact with your cholinesterase enzyme, and we are getting this particular hydroxy quaternary ammonium salt and the acetic acid. Yeah. And the effect anticholinesterase. So we have the mechanism of this one, cholinesterase. So here is a acetylcholine. It is released from the neuron synapses and it is blocking that particular uh, ACH receptor here. Yeah. Next, the structure of acetylcholinesterase. The acetylcholinesterase enzyme, it has fascinating tree-like structure here. Fascinating tree-like structure. tree-like structure. The trunk of this tree is a collagen molecule which is anchored to the cell membrane. There are three branches disulfide bridges here. Three branches disulfide bridges like your immunoglobulins. It have also the disulfide bridges leading up from the trunk. Each of which holds the acetylcholinesterase enzyme above the structure of the membrane. So you can see the structure of the cholinesterase enzyme. Is the acetylcholinesterase enzyme structure. It is seems like three and three branches disulfide disulfide. That is acting on anticholinesterase. So these are used therapeutically mainly in the treatment of coma and in the anticholinesterase agents. It is classified in two types basically, reversible inhibitors and organophosphorus compounds here. Reversible inhibitors, right? So generally the enzyme inhibition two types, okay, like uh, reversible, right? So reversible, irreversible. Okay, reversible inhibitors. We have the example under this. The five physiostigmine and neostigmine. The synthesis of physiostigmine, we have the synthesis of this physiostigmine, where it is starting by taking the dimethoxy estophenone when it is treated with the acetyl cyanoacetate. So when it is treated with this acetyl cyanoacetate here, so where what is happening here generally with yeah, right. So here the two hydrogens here, right. So the two hydrogens on this phase with the water removal is taking place here, and it is going to attach with this particular estophenol derivative, and further by treating with this hydrogen cyanide, followed by the hydrolysis of ester and decarboxylations, we got this intermediate compound here. And further, by doing the reduction of the cyano group and followed by the alkylation reactions, so we got this intermediate. And immediately by reduction with the hydrogen iodide, so it is giving this particular intermediate compound here. And by treating with this potassium ferrocyanide oxidation reaction, with right, so with this hydroxy group, okay, so this hydroxy is converting into the nuclear carbonyl, and further with the internal reaction is taking place with because here the amines, two amines, so it is going to react with carbonyl and it is going to form the adjacent cycle. to this 5-member adjacent to that 6-member ring. And same the another internal reaction by attacking of the lone pair electron on this nitrogen derivative. So it is going to attack on this one, and it is going to form the tricyclic derivative. And finally, by treating with methyl isocyanide, it is going to form your zero stickling. Zero stickling. Yeah. And this physiostigmine generally it is alkaline used in the treatment of glaucoma to reduce the intracellular pressure when applied topically to this particular eye. Next, neostigmine. So neostigmine is used as a cholinesterase inhibitors here, and it is used in the treatment of myasthenia gravis and to treat the constipation. Neostigmine. So it is also cholinesterase enzyme inhibitor like physiostigmine and neostigmine. So both are cholinesterase inhibitors. So this is used to treat the myasthenia gravis. And compounds, this organophosphate esters such as diisopropyl phosphofluorochloride here, we call it is isofluorophosphate, and ecothiopate. These are long last covalent acting cholinesterase enzyme inhibitors here.